one day I was doing housework, I was making the bed, and I got very short-winded. And I had to sit down until my air came back, and I couldn't figure out what was going on, so I called the doctor. My name is Carol J. Jurdy. I just turned 70 years old, and I have COPD. But when I went back home, I was on oxygen. That was very hard to adjust to because I kept thinking I would only have to be on oxygen for like a couple days and I would be better again. I didn't realize how strong and powerful my disease was.
I met Carol in 2012. She contacted Reliable Medical Supply, inquiring about our ability to help her with her BiPAP equipment. The provider that had been providing her with that equipment had not been doing a great job at follow-up, and she'd had some skin breakdown issues with the mask that they had provided with her. I met with her in her home, fit her with an appropriate mask, and we resolved that problem. I didn't think much about it from that point forward until she called me one day. Her husband actually called me one day and said, Carol is back in the hospital with another COPD exacerbation and wanted to know if there was anything else we could do for her. One of the big things for Carol is on multiple occasions they had wanted to move her to hospice. They felt like her condition was basically hopeless, and she wanted to fight on, so I'm glad she contacted us.
During my last hospitalization, I called Reliable Medical. I was enrolled in their Excel program and placed on a trilogy. From that point on, follow-up has been amazing. I have not been hospitalized in 2 years.
Reliable Medical Supply's Excel program is a program we put in place just to add some structure to the way we manage these late-stage COPD patients in their home. First of all, it allows me to go into the home, educate the patient on their disease and their disease state. It allows me to recommend or fulfill doctor's prescriptions for the appropriate therapy, clinical follow-up, where we can do full clinical assessments, and then reporting back to the physician the patient's condition and our findings, and if anything changes. We can be kind of a go-to resource for the patient before they get in trouble and ultimately end up in the emergency room or in the hospital. So since implementing this therapy, she's gone from her physician thought the best course of action was to place her on hospice. That was how dire her situation was prior to us implementing this program and these therapies.
I hope this video shows people who have the same disease I have that this helps. There's a lot of people out there who, maybe in nursing homes who don't have visitors anymore and who are just giving up, and I think that's important that they know about this. If anyone else was in my position, I would definitely recommend Reliable because I have full confidence in them, and I know anyone who uses it will too.